Hello and Assalamualaikum. I'm Putri Nur Shahira from BPT 27B. Today I want to present about tendon reflex.
Tendon reflex test or deep tendon reflex test (DTR) is a part of the motor activity assessment together with the muscle tone and muscle strength test, which is beneficial for locating nervous system lesions, or we can just say to determine whether someone has neurological condition or not. It evaluates the reflex arc, which involves motor nerve, sensory nerves, and spinal cord. So here is the purpose of this test, which can detect abnormalities in central and peripheral nervous system and also can help in diagnosing condition like neuropathy, radiculopathy, or motor neuron disorders. So basically the deep tendon reflex, or more accurately, the muscle stretch reflex, can aid in evaluating neurologic disease affecting afferent nerves, spinal cord synaptic connection, motor nerve, and also descending motor pathways. So these are the type of reflex, which are normal reflex, hyperreflexia or areflexia, hyperreflexia, and also clonus. Normal reflex indicates motor nerve, spinal cord segment, sensory nerve, and muscle are functioning appropriately. While hyperreflexia or areflexia, or we can just say reduced or absent reflex, indicates injury or disease to the lower motor neuron, peripheral nerves, or nerve roots. As an example, peripheral neuropathy and also Guillain-Barré syndrome. While hyperreflexia is exaggerated reflex, so it indicates injury or lesion to the upper motor neuron or central nervous system, like stroke, spinal cord injury, multiple sclerosis, while clonus is involuntary and rhythmic contraction of muscles caused by injury in the descending motor neuron. It accompanied by hyperreflexia, spasticity, and muscle weakness. So we will discuss about the deep tendon reflex grading in the next slide. Here is the deep tendon reflex grading. There is 5 grades including 0. So the first one is 0, which indicates no reflex or reflex is absent. Like what I said in previous slide is areflexia. So while for the first grade is less reflex than normal, or we can just say the reflex is small. So it includes a trace response or a response brought out only with reinforcement. While for the second grade is reflex in the lower half of normal range, while the third one is upper half of normal range. So the last one is 4 grades, which is reflex is more than normal or it enhanced, or we can say hyperreflexia. So it includes clonus if present, which optionally can be noted in an added verbal description of the reflex. There are 5 primary deep tendon reflex, which are biceps, triceps, brachioradialis, patella, and ankle. But the commonly tested is 4, which are biceps, triceps, patella, and achelis. It is because brachioradialis segmental innervation is same with bicep reflex, which is C5 and some C6. Well, the nerve supply for brachioradialis is same as triceps, which is radial. So bicep and tricep is more preferred. So the muscle involved in biceps reflex is biceps brachii. For the tricep is triceps brachii. And the segmental innervation for tricep is C7 and some C8. For the patellar reflex, we can see the knee jerk. So the muscle involved is quadriceps femoris, and the segmental innervation is L3 and some L4. For the Achilles reflex, we can see the ankle jerk. So muscle involved in this reflex is gastrocnemius and also soleus. The segmental innervation is S1 until S2. So later we can see how this test is being done for the common reflex part.
Hello, Assalamualaikum. I'm your physiotherapist for today. I'm Putri Nur. What can I call you?
Ashraf.
Okay, Mr. Ashraf. Today I want to do tendon reflex test or deep tendon reflex test to test your nervous system or whether you have a neurological condition or not. So if you have any pain or discomfort, you can just tell me, okay? Can we start now? Okay. Firstly, we want to I want to test your tricep reflex. You need to relax. Okay. Then I will okay. There's a jerk, so we can see that the reflex is normal. Okay. Then we proceed to bicep reflex. So, can you contract the muscle?
Yeah, sure.
Okay. So, there's a jerk. So, the reflex is normal. Okay, next we want to do patellar reflex, which is at the L3 and some L4. So, can we start now? Here. Okay, you can see the jerk. Okay, next we want to proceed to the last one, which is the Achilles reflex. So, we will ask the patient to prolate and with your leg hanging in the edge of the bed. Okay, can you lie on your tummy?
Sure.
We want to do at the S1.
So that's all from me. Thank you for your attention.